Hi, Garrett.
Hey, Becky, how are you?
I'm good. How are you doing?
Doing okay.
Or is it okay with you if I pass off the hosting to you?
Yeah, that's fine.
Oh, that would be great. I gotta keep working on something else tonight.
Not surprised.
Are you
There's always stuff to do, right?
Oh my God, especially this time of year.
Yep.
And are you guys close on the agreement? Is that
I think so. I don't have a problem with it.
okay?
Yep.
Very good. All right, have a good meeting.
Thank you.
Make you.
Now, were you sticking around for the mosquito discussion though? I got the impression from what Kat had sent out that you were going to be,
Okay.
because there was maybe something that needed to be addressed that would also involve you.
I'll then hang on till she is here. So
Yeah, I think we should double check that with her.
okay.
Because in her email, I got the impression that you needed to be a part of the discussion.
Okay.
Arlene, did you get that impression too?
Oh, you're muted.
I started my audio in the middle of what you were saying, so I am not clear what the point is.
I got the impression from Kat's email that Becky needed to be a part of the mosquito discussion.
I did too. Yeah.
Okay. Hi, Catherine. Garrett has been doing a good job making sure I stay for the mosquito discussion.
She
Thank
tried to go and do other work, and I didn't let her.
No, and that's totally unacceptable. Great. So Becky, do you want to make me meeting host, or did you do that for Garrett?
I did it to Garrett.
Okay, good.
So
That's fine.
he needs to maybe Garrett, you should make Catherine co-host just for good backup. Especially since that's her name.
Yeah,
Not for long. I'm going to change it. I don't know why it doesn't stay. I change it every time.
Hi, Wim.
Hello.
Is Noreen not here yet?
Not here yet.
Okay, I'm gonna run grab something. I'll be right back.
Okay.
Me too.
Oh, shoot. Me too, then.
Was it something I said?
Hi, this is John Briggs. Can you hear me?
Yes,
Yes.
we can hear you.
Hi. All right. I'm going to log off and then log back in. I just had a Zoom meeting and my camera was working, so I don't know why it's not working. I'm going to try to reset this.
Okay.
So I'll be
Okay.
right back.
Okay.
All righty.
All right.
How y'all?
Pretty good. And you?
I wonder if Noreen forgot.
Want me to send her a text?
Sure.
All right.
Oh, come on, see. Oh, there she is.
Oh, well, forget that. Okay.
So it's 7:02. Hi, Noreen.
Mhm.
I guess she's going to just go get something. It's going around. So since it is, oh, we're on recording. Good. Okay. For the record, this is the Board of Health meeting of May 3rd, 2023. And the whole Board of Health is here, namely myself, Catherine Hilton, Garrett Simonson, Arlene Reed, Wim Levine, and Noreen Pease. We also have Becky Torres, the town administrator, and in a minute we should have again John Briggs, who logged out and is going to log back in to try to get his camera to work. What's making that sound? Excuse me.
I'm hearing a sound too.
It's just, at my house, at least, it's just a blower. Oh, there he is. Hello, John.
You're muted.
Right. So you, John, you're first on the agenda. Why don't you unmute yourself and you're making me dizzy.
Okay, there we go. Can you hear me now?
Oh,
We
yes.
can. We can see you too.
All right, good. Sorry about that. I was just in a meeting too with the town of Rowe, and I was at their Board of Health meeting, and my computer worked fine. I had the camera going, and for some reason, it just wouldn't work this time around. I didn't change any of the settings.
It's a mystery.
Yeah, that's Zoom.
Yeah, that's life on Zoom. So did you ask us to meet with you, or did we ask you to meet with us? I can't remember.
I've been doing like an outreach campaign since I've started. I've been trying to get in touch with all the towns and meet with them. And really the main objective is to get kind of like your concerns about surveillance, and then to let you know what I'm doing, the vector species that I'm targeting, why I'm targeting those, the processes involved, and notifying you with if there's any kind of arbovirus, and then also to get your input. I've been finding that a lot of you folks out west tend to know exactly where your cattails are, or the very specific habitat that I'm looking for. So pretty much with every town that I've met with, they know exactly where the habitat is that I'm looking for. So what I'll do is once I get that information from you, I'll go out to that area and actually sample it to see if it actually has that species that I'm looking for, which is a vector species.
Just one species?
No, so we have multiple vector species. The main species I'm looking for with in regard to cattails is Cochleatidae perturbans, and they're more of a specialist species. So what they do, why we associate them with cattails, is because they latch in the larval phase, they'll latch themselves onto the cattail root, and they'll get oxygen and nutrients through that root. And there's no other mosquito species that will do that. All other mosquito species in the larval phase, in the pupa phase, will go to the surface in order to get oxygen. Whereas perturbans will go right down in the muck and attach themselves to those cattail roots, and they're significant in public health because they're a bridge vector for triple E. So they'll feed on infected birds or those reservoirs for triple E, and then they'll feed on us, and that's how we get triple E, and that's why I'm looking for cattails.
Okay, we can find you some.
All right, good.
Our concern at this point has been more administrative. We found out recently that we haven't paid our bills in the past, but we also haven't gotten any reports in the past. And so we kind of don't know what's going on.
So unfortunately, you guys are not the first ones to tell me that you have not gotten reports. So recently, I think I've sent out 15 to 16 reports to towns. So you guys are not the only ones that did not get reports. I have no idea what happened before me with my predecessor as to why those reports weren't sent out. But if it was me, I'm very much on top of things. I would send those reports out pretty much right after the surveillance season in the fall.
It seems to me that the first year we had surveillance, which is the only year we really knew we had it, we were getting frequent reports, maybe monthly.
Okay.
Does that sound familiar?
No, so I do not know the history of what happened, but are you speaking of weekly reports or monthly reports?
I'm not sure, but more frequently than just one at the end of the season. Maybe monthly.
I would say typically, so I've been in mosquito control since about 2015. So I worked at Central Mass Mosquito Control Project for, since then. And We've never given out weekly reports or monthly reports. So and I had seen that language in the invoice, and I can see where that would be. There would be some confusion with that. Annual reports are expected. There should be an annual report at the end of the season, giving you a summary of the data and everything of our findings in the test results and whatnot. For the weekly reports, and I've been telling the towns I've been meeting with, it's not, and again, I don't know why that was in there, that language, because I don't know any of the projects that do weekly reports because it's not feasible. We're not a private business, we're a state agency. So we don't have enough employees to set someone aside to do 10, 11, 12 hours of report writing every week during surveillance season. So it's almost like being an attorney or a tax attorney during tax season. You have absolutely no time to do anything else other than that. So during surveillance season, it's all mosquitoes and it's all public health too. So we're looking for that virus and looking to get you that information as soon as possible when there is virus. But another thing I've been telling towns is that, I'm sorry about the phone, I'm going to put it down so it's not giving you motion sickness, that you can contact me at any point during the surveillance season and I will get back to you. And even if you want me to check in like every month to give you a phone call, I'll do that. And I'll give you a summary off the top of my head. I'll be able to tell you what I'm finding. Say last year during the extreme drought in Central Mass, we weren't finding any mosquitoes. And I'm sure there were a lot of boards of health wondering what the heck was going on and how the drought was affecting the mosquito population. If it's something where, keeping that open line of communication so that you guys can get that information, that's perfectly feasible for me. I can definitely do that. I put my cell phone in the report, and I've already had towns call my cell phone, and that's absolutely fine. That's what I'm here for, is to give you that information on the spot.
That sounds good, but we shouldn't expect written reports except at the end of the season.
The only thing for me that's feasible, because I'm the only one that's doing everything now, so I'm collecting and I'm also identifying the mosquitoes. So I'm playing director, entomologist, and then field tech, all these roles that I'm playing right now. And like I said, even with Central Mass, and they're relatively big compared to other projects. They have a lot of people on the payroll, but like I said, it's a state agency. We really don't have a lot of extra people floating around where we can set aside time to write those reports. I can see why you guys would want them, and I definitely would like to write them, but I can't feasibly. I would not be able to do that right now, and that's why I'm not sure why it was ever written, because I can't imagine my predecessor having the time to do it.
Well, apparently you didn't, because we haven't had any for years, but we didn't have any year-end reports either.
Yeah,
that was a problem.
That's something you guys should certainly get every year's annual. And again, if you guys want check-ins, if you want to call me at any point during the surveillance season, that's perfectly fine. And I'll get right back to you, or if I'm not in one of the hill towns, I'll be able to answer the phone and actually get it, because I've already experienced no service out there.
Right.
I wonder if the weekly reporting came up about, so DPH issues weekly surveillance reports. So maybe that's where the wires got crossed.
DPH. Oh, so DPH gives like that might be, again, I'm not sure why it was written into our invoice, but DPH does give like an update as far as, high risk areas regards to arbovirus. So that is definitely something that it's on their website that you can access. And I'm not sure if I don't think they actually send it out. They might send it to me. If they were to send it to me, then I would certainly forward it to all the boards of health. I'm not sure what they do if they send it out to the boards of health already. I know that when we get a positive virus or positive pool of mosquitoes for virus, the DPH will contact you first, and then I'll follow up with you with the details regarding that positive pool.
Right. And it seems to me that if there's any significant arbovirus out there, we hear directly from DPH, even if it's not in our town.
That's correct. So DPH, they are the gatekeepers of all data that's related to any kind of testing, especially arbovirus. Everything goes through DPH. That's just the way it is, unfortunately. And, they do all the testing. So they want to control that data, and they'll get out and contact you guys in advance to let you know.
I saw some hands up.
I'm just curious, John, how often do you monitor the traps in towns?
So the traps are, it's weekly. So every town has a bye week. So that was something that my predecessor did, and that's what most districts do. So every town has a bye week. So if there were 16 weeks of surveillance, and we had 16 weeks, you would get 15 weeks, just like all the other towns would get 15 weeks. That's how it goes. So I would be placing out 2 traps per week. So you would have a gravid trap that would specifically target West Nile virus vector species. And then you would have a CDC trap that would target EEE vector species. So those 2 traps would be placed out weekly and rotated throughout all of the trap sites.
Great, thank you.
How many trap sites do you maintain in Shutesbury?
How many trap sites? So I think you guys had, and I just closed my computer. I think you guys had 4
That
sites.
sounds about right.
I would like to, ideally, I'd like to add more. I think the more better to have more locations. And like I said before, I'm looking for locations that are in close proximity to vector species habitat, and then areas where people are more inclined to gather outdoors or residential areas.
Your predecessor, I think, focused on putting the traps on public lands. Is that something that's a priority for you?
Well, it depends. If it's a recreational area, then sure, that works. But I go into residential areas I've already gone to several houses, and I'll knock on the door and I'll tell them where I'm from, and I'll ask them for permission to put the surveillance trap on the property. If I have to knock on someone's door, that's fine with me. It's all about public health and where is this trap located in respect to the habitat. If I'm putting a trap in a location that's where people are gathering, but there's no real vector species habitat in the area, then it's not necessarily the best spot, so to speak.
Yeah, those 2 things don't necessarily coincide. Gathering of humans and breeding areas for vector species. I live in an area where there are a lot of cattails in swamps.
Yes.
But there are no people.
Right. Yeah.
Well, except you.
Except me. And I've already gotten my first mosquito bite of the year.
Oh,
Yes.
no.
Yep. So we're seeing. I went out to Pittsfield over the weekend, and we were doing a sampling event. It was me and some other scientists and some academics, and we're doing this research project. And we noticed that there were a lot of mosquitoes that were already ahead of schedule. So I'm not surprised to hear that. And then you have mosquito species that will overwinter in the adult phase. So they come out and they're ready to get their blood meal. So they're all ready to go. So you might have dealt with those, or one of the many spring brood species. We have about 19 different spring brood species that will come out in just the spring, and then that will be it. They'll die off, and then in come the summer species.
Well, and so how would we convey to you potential sites if you wanted to check a place out that you thought was promising?
You know what, if it's a cat, if you have an area that there are a decent amount of people, I know that it's very, it's not very densely populated out west in your areas, which is fine. So if it is that the case, then if that's the case, then I would still want to focus on cattails, because that particular species, perturbans, can fly up to 5 miles for a blood meal. So when you put a 5-mile radius around that habitat, you're certainly expanding the and they will, usually out east where I am, from, they don't have to fly that far for a blood meal because it's more densely populated, but out west, they'll probably fly three miles or so just to get a blood meal. So that's fine out west. I'm kind of adapting to that. So if you have cattails and it's breeding, it's still good surveillance because say there's Triple E that pops up in that particular spot. Now we know I would put a 5-mile radius around that spot and say, hey, this is the area that you really need to watch out for.
Well, we have plenty cattails around Lake Wyola and plenty people around it too. So
Okay.
that'll be a good spot for you.
Okay, awesome.
Maybe Kat or Wim or someone else in this meeting knows whether or not the acres that Julian Janowitz recently donated to the Kestrel Trust and on which a boardwalk has just been constructed through a cranberry bog, are there cattails? I would imagine that area has got cattails. And because it's public land, well, it's owned by the Kestrel Trust, but open to the public, and has this boardwalk, I'm thinking that might be a place that is the combination of the right kind of vegetation that John is looking for, the right habitat, and a place where people may congregate.
Yeah, they will.
And it's not very far from the lake, from the beaches on the lake. So they would be in range of that.
Okay. So I can probably sample all around to see if there are actual mosquitoes in that area too.
Mhm.
Which there probably are. If you have cattails, if it's permanent, really any place like lakes, the edges of lakes, that's permanent water, and you're going to have that species in that area because they will overwinter in the larval phase. And what they do is they keep down into the muck, and that they never freeze. So they've evolved. They've had so many millions of years to evolve to survive.
Are you looking only for cattails, John, or are you just looking for wet spots?
So that has to do with Triple E. So the other species that I'm interested in is also, it's a main vector for Triple E, but they primarily feed on avian species. So they're the ones that amplify the virus amongst the wild bird population. And the perturbans come in, they're the bridge vector. So they'll get a partial blood meal from a bird, and then they'll go feed on a human. And then that's how we get the virus. So that's kind of play a role in the virus cycle for Triple E. So with Culiceta melanura, that's the primary bridge vector for amplifying the virus. They reside in these, what we call crypts, these sphagnum moss crypts that are usually found in red maple swamps, which we have plenty of, around here, and you guys have plenty of them around there too. There's just so many of them. So I'll be looking for those as I'm surveying for perturbans, and then also, during the off season, I plan on going out and mapping every habitat possible that I can find. That way I'm compiling my own database. And this is something that I did at Central Mass. I ran the GIS at Central Mass, and I ran our Triple E larviciding program. So my job was to find these two different habitats and map it, and then give it to the aerial crew so that they could larvicide. But I think even just having that out and creating a database is going to be very helpful. So I plan on doing a lot of that ground truth in the area during the off season and get that database going.
When does the testing season start?
It typically starts. So I'll start trapping the first week of June, and DPH will start trapping around that time too. We are doing a pilot program for Jamestown Canyon virus, which is not an immediate threat at all. We're participating in research with UMass Amherst. So we're just submitting species a little ahead of time. So with Jamestown Canyon virus, we have some suspected vectors, and it's not very prevalent. So what we're doing is we're submitting those suspected vectors, which is spring brood species. And what I'll do is I'll start trapping mid-May for those. It would be very downscaled. I'm going to get at least one trap in every town. It would just be CDC. So I would be doing that. And then June would be the full scale trapping. That's when we start looking for the Triple E and West Nile virus vectors.
Becky, you've had your hand up for a really long time. Sorry.
That's okay. So I, I really appreciate all the science, but I'm afraid my interest is financial at the moment. I'm the town administrator who came across the problem that we hadn't in an ongoing fashion built the mosquito control $5,000 a year fee into the budget. When we originally made the first payment, I think it was 21, we used free cash to fund it. And we paid that one, and there had at that time been talk about potentially doing a regional grant through the MVP or something to cover the cost ongoing. So when I didn't see a request come from the Board of Health, I didn't really worry about it because I thought, well, we're probably into the grant funding stage, but I didn't check in with Kat. There was no grant funding, and we got 2 years down the road. So the second year is this year. We potentially might be able to get that one paid. The quandary is what to do with the year in between. And Kat was uncertain whether the services had been received, and that's part of the reason for the conversation. So I just, am trying to understand from your perspective, do you feel that services had been received during those 2 years, and that we do in fact owe the money, the $5,000 for each year, or not?
So I'm not a business owner. I have no say in any of the financial stuff, so to speak. I can't declare anything. What I can tell you is that what I get my data from is the DPH database, and anything that my predecessor collected and submitted to DPH for testing, it shows up on the database. So you can see that he was trapping during that time. So he was providing surveillance, those services, but it sounds like he just wasn't communicating that to you, unfortunately. So the services were there as far as the public health service of having that surveillance. And then if there was virus, you guys were covered. So that's basically, the basic service was there for that in that respect.
And you, from what you've said today, I understand you are the whole program pretty much, or is there, there's no administrative level, someone?
Well, I have a board of commissioners, so they're pretty much my bosses, and they clear everything. I can't make any decisions financially on my own or declare anything on my own that significant. It needs to go before the board of commissioners. Or the board of commission. And then I also have, it's the state. So there's a hierarchy. So I have SRB, it's the state reclamation board, and also MDR that I have to answer to as far as, administrative people. So I am on my own in a sense doing all of the legwork, but as far as making, it's not my own business. I make the decisions on my own in that respect. I would have to go through people, a series of people, hierarchy of people.
Okay.
Becky,
So,
had we received a bill for those 2 years?
not that I know of.
Oh,
Not in sort of real time, but this all came up recently when John's predecessor left, and someone at the district, the Pioneer Valley Mosquito Control District, sent out sort of past 2 bills going back a few years and threatening us with cessation of services if we didn't pay up.
Oh,
okay. Might have been SR.
Yeah, so we have received bills in the last month or 2.
Okay.
But we didn't receive, so the half of it was done. The services were provided, but we didn't get the reports.
Right.
Or the bills until.
Or the bills or anything. There was one bill that we got for the second year, and that went to the town treasurer, copied to me, and I thought, in my innocence, that that they were handling it there, and I didn't follow up. Then the year after that, we got no bill at all.
So there were a lack of invoices, it sounds like, for certain years.
Yes.
Catherine, was that bill you're talking about that went to the treasurer, was that the second year or the first year when we had funding?
It was this, I think it was the second year
When we didn't have funding?
when we didn't have funding, and I was unaware that we didn't have it.
But we managed to pay the first year even though we didn't get a bill.
Presumably, we got a bill for that first year and we paid it because we have the funds. In fact, yes, Gail told me that she had paid that one. But
Okay.
then when the next one came to her, she said she didn't have a line item for it, and so she didn't pay it. But she also didn't tell anybody that she didn't pay it.
So that's fiscal year 21.
I think it's 22.
It
20.
was 20.
You know,
we're in
the
23.
fiscal year part of this, John, is making us tear our hair out because the fiscal year, how the fiscal year matches up with the actual testing season is
Yes,
kind of a big mystery.
yes. It's been hard for me to adjust to also. Because it's basically surveillance starts a month before the fiscal year ends. So it's
Right.
still getting adjusted to that.
Yeah, well, we haven't adjusted to it at all, and we're in constant confusion about it. So if the invoices that come in the future can be a little bit more clear about what we're paying for and when we're paying for it, that would be really helpful.
Okay, so I think,
Arlene and I were trying to work on this, and we were just, our eyes were bugging out of our heads.
so I think if you had paid last year, it would be covering up through June, and then after June 30th, it's fiscal year 24, and then it would just be the same thing. It's really very confusing, and I'm dealing with it with the budget, with purchasing CO2 and everything in order to be. So I guess that's the best way to explain it, is that fiscal year 23 covers the first month of surveillance, then 24 covers the remaining months.
Oh, kill me now. That is just too complicated. Well,
Yeah.
the first year that we paid, we got services in, I think, 2020. And we paid for them all at once, presumably
I
in
think
fiscal
it's actually
21.
It was 21 that we
If
started.
21 was the first year we got services?
I think
Oh.
so.
Okay.
Because we're in fiscal 23 now. We didn't pay in 22. It's not budgeted in 23. It's budgeted for 24.
Right. And so what's budgeted for 24, what season is that? Is that for the season that's ahead of us right now?
Pretty much after June 30th, yeah. So that covers most of the surveillance season fiscal year 24. So that would, I suppose, if you were looking at it that way, it would start July 1st, your surveillance
Yeah.
season.
July 1 through June 30th.
Yeah.
What'd you say, Win?
July 1 through June 30th
Right.
of next year.
Yeah, so you'd be covered the first month of surveillance season 2. And again, I could write this out too and send it to you so that it's more clear. It's annoying. I find it frustrating too.
So I guess
Go ahead.
bottom line financially, it's we just need to sort out and then the board can talk about what you think needs to happen, given all the information.
Right. I think that sounds like it's above John's pay grade. And if he can give us some contacts that are responsible for that sort of thing, we can take it from there.
So what I can do is that we have a meeting on the 8th, and if one of you guys want to join that meeting, the commissioners, that might actually help too. It might kind of fast track things.
May 8th.
Yeah, it's May 8th, it's Monday, and it's at 2 p.m. And what I can do is get you the link to that. And just to clarify, so you guys said that it was not a line item in fiscal year 23?
Correct.
Okay, so it's not funded for FY 23. It's a line item for FY 24.
It
Okay,
was not a line item for FY 22 either. It was in 21.
okay, FY 21.
And we believe that one was paid, but in FY 22 and 23, it was not a line item. If we have ability potentially to pay, well, if we have finance, the finance committee potentially might be able to pay 23. Our problem, we have a problem paying 22. It would be a bill of prior years. So I guess it's complicated. We have to figure out if the board feels that the money is owed. It's just it's been a little up in the air.
So you guys didn't even approve the funding in your, so usually from what I understand is that every year you would have to approve the funding and I'd have to get those certified meeting minutes, indicating that you approved it. So you guys don't even have that. It's that. what you're
When you say you guys, which guys are we talking about? The town, the board?
Town. Yes, usually from what I understand, because I'm trying to get Northfield into the district in the process, I understand that has to be done every year because it's a voluntary appropriations, is that you guys would have to add it into your budget meeting for, I believe usually happens in May, and then approve the funding for $5,000 and then, certify those minutes, and then I would get a hold of those minutes and then present them to the SRB. So I'm not sure how anything ever got beyond that without the minutes. I could be missing something again.
Well, we did have a town meeting in, I guess it was 21, in which the town voted to join the district.
Right,
But
okay.
it was our understanding that we only had to do that once, and then we simply had to appropriate the money for it every year.
Oh, okay. So someone
But I
definitely
think
did.
what John's describing is a certification of the vote to approve
Correct.
funding.
Okay, so we don't have to vote over and over to join.
We didn't, right, not to join, but that we approved the funding, but we did not do that in 22 or 23, and we can't because it's gone by.
Right, correct. Yes. Yes, that is something that needs to be brought up with the board, I think.
Okay. It
I'm
sounds
sorry, be more helpful.
complicated.
I can't, I'm not gonna lie to you guys or, say this, you can do that. That is definitely something that I think the board will have to decide on.
Okay, and there's a meeting at 2 p.m. on Monday, this Monday.
It
And-
is coming Monday in, May 8th. And then I'll try to add you guys to the agenda and give everyone kind of a background of what's going on in regard to those fiscal year 22 and 23. That way, hopefully we can make some progress in the meeting.
Okay,
That would be great. Now, you said this was the commission. What commission?
Yeah, it's so every district has a board, and it consists of 3 to 5 commissioners. And essentially anything that is related to finances, any kind of improvements, even hiring and firing decisions tend to lay on the commission. I think once I get established, I would have more control over personnel issues. or personnel hirings and all that stuff. But for now, everything pretty much goes through the commission, especially an issue like this would go through them.
So this is the commission of the Pioneer Valley Mosquito Control District.
Yeah, so yeah, like I said, every has their own board, and are specifically for Pioneer Valley.
Okay.
And they're represented, they're people, boards of health in member towns. We have Jean Galloway as the chair, and she is the Board of Health in West Springfield.
Go ahead, Noreen.
We know other people on the board. Carolyn Shores Ness is on the board and
Yeah.
Greg Lewis is also on the board.
Yes.
So the board knows who we are and has worked
Yeah.
with us on other things.
Yeah, they are certain. Yeah, they've definitely worked with you guys. Yeah.
I mean, it sounds like from what John's saying, we were provided services in those times. So there's evidence of provision of service. And so it seems like we should try to figure out how to provide compensation for it.
No, I can't tell you that, from speaking with other districts that do use voluntary appropriations, you can, if you do get to the point where you're going to pay for those services that were provided in the past, you can do quarterly payments or something like that. Because I know East Middlesex does do quarterly payments with some towns.
That's not the issue.
Okay.
It's having it or not having it, and figuring out where it's going to come from.
Okay.
And right now the funds are not available, so
I-
we have to figure that piece out.
Okay.
Becky, do you think you are the appropriate person to be in that meeting on Monday?
I think it would probably be helpful for them to have a familiar face too. So if Noreen and Kat can be there too, that would be helpful, or Garrett, or any, someone that knows someone on the board would probably be helpful.
Would really be helpful to have Noreen there if you're available, Noreen.
Monday at 2.
Yeah.
Yeah, I'll try and make myself available.
I will too.
And I'm sorry to dump all this mess on you first, as we're getting to know you, but
That's quite all right. I understand. That's fine.
we'll figure it out.
And how will we get the link for the meeting?
John's going to send it to us.
Okay,
I send it to you guys, post it online, so I'll get that to you. I'll send it to
Thank you.
Kat.
All right. Yeah, and I'll send it to everybody.
Great. Well, thank you so much. I really appreciate all the explanations and hearing about your
Well,
program.
All right. Thank you, guys. It was nice meeting y'all.
nice to meet you.
Is there's not anything else you wanted to tell us or hear from us?
No, I wanted to get those cattail areas and kind of let you know what I was doing for the surveillance season and what I'm targeting, so you kind of get a good idea of kind of the purpose of going and why we're doing it.
So are you going to be making a site visit in the near future? Are you doing this
Yeah.
all with GPS? Or so if you let us know, possibly some of us meet with you and
Okay.
We
show
can
you.
tour around some cattail hot spots.
Yes, we're gonna avoid going into the cattails though. That sounds good. We'll be chasing cattails.
Yes.
Okay. All right. I'll be in touch. Should I just contact you, Kat?
Yeah, send it to the Board of Health email and I'll
Okay.
I'll pass everything around to everyone else.
All right. Excellent.
Great. Well, thanks for coming. Very nice meeting you.
Nice meeting you guys too.
Thanks.
All right. Have a good one, guys.
You too.
Bye.
Thanks. Bye now.
Okay. Who has jingle bells? There's a
That's-
little jingling sound every once in a while. I wondered who was causing it. Well, whatever. Well, he seems a lot more outgoing than Chris Craig, who was a little bit introverted, I guess. So, well, we'll deal with it on Monday. So back to our agenda. How are we on the minutes of the 2 April meetings? I sent out fresh minutes from the last meeting and a second set of minutes after Noreen gave me some more input on the meetings of the minutes of the 5th. Is everybody satisfied with the minutes they've received?
Mhm.
All right, then we'll just approve them. Other updates. Noreen, do you want to tell us about what's the latest at the Health Coalition?
Well, basically, the push this month is for everybody to review the IMA, which everybody got a copy of this week. And I should have asked Becky while she was on. I assume she's forwarded it to the select board, Kat?
I think I sent it to the select board, actually.
Yeah, you did. You did, as a matter of fact.
I sent it
So-
to everybody.
So I don't know if people have had a chance to look at it, or if we have any questions we would want to submit back to the attorneys to answer. So I'll just leave it at that. Has everyone had a chance to take a look at it? Is there anything that we are concerned about or have a question about that we would send back to the attorneys, including Donna McNichol, to review? And just so everyone knows, it's a little more efficient because both Leverett and Shutesbury have Donna as an attorney, and Greenfield's attorney has already worked on it. So that kind of narrows down the attorney input on the document.
Does Donna represent any of the other towns in the coalition?
I don't think so.
Because I know she
I
has a
know
bunch
she-
of towns. Yeah.
Yeah, I know she doesn't have Deerfield. She might have Sunderland. I didn't check on that one.
No matter. It seemed pretty standard. I mean, I can't imagine that we would have anything to say that the attorneys haven't figured out. I think it's really up to the select board to ask questions if they have any. And I haven't heard from them or from Donna.
Yeah, I agree with that.
A lot of boilerplate, a lot of whereases.
Oh,
Yeah.
yeah.
I did have one question, I guess. I don't know how well formed the question is, but on the first document, page 4, there under a heading of shared services program participation, part E says, each municipality will assist in collecting the necessary information as agreed to by the oversight committee, and pursuant to the reporting policy, blah, 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 blah. The data collection provided will include, but not be limited to, reporting public health outcomes and services related to the program and the agents and nurses. I've abbreviated that a little bit, but so there's a bunch of data collection being stipulated in here, and so that will fall upon us because it's each municipality needing to do that. That would not be the shared services nurses doing that. I mean, this is how I interpret it, that would be our board's responsibility to do data collection. And I don't know that any of us is equipped to begin designing and implementing a data collection tool. Do you think I'm right in the way I'm reading that?
I'm on page 4. You said it was 4F?
Or E?
4E, okay. And I'm trying to read it on my phone. so-
Page 4, it's
Yep.
section 7, letter E.
Yep,
Of
okay,
the
I got
first
it.
of the two documents. So it suggests in here that each board is going to be responsible for collecting data and reporting public health outcomes?
My guess is, and you were on this meeting, Garrett. For example, when we participated in the assessment tool, the baseline assessment tool, to
Yeah.
find out, what kind of training we've had and what kind of
Mhm.
jobs we do and don't do on this board.
Mm-hmm.
And I think there were 6 content areas that were reviewed. My guess is it's reporting and updating that kind of data. I don't think
Okay.
it's not any specific healthcare data related to patients or that sort of thing. It would be more if we decide as a group, and we are required to participate in this particular process because it's one way that the state evaluates how well we're doing and grants us
Sure.
more money. Like this week, we just got a notice from them and we're getting, I think it was $194,000
Right.
more money.
I saw that. Yeah.
Yeah. So I believe that is the intent.
Okay.
of
So
that.
you think that we are going to be provided the tools
Yes,
with
absolutely.
which we'll be able to collect data and convey something about public health outcomes.
Yes, as a matter of
Okay.
fact, I'd ask the question. They're supposed to be setting up a dashboard that we will be able to access to see
Oh.
our own data. Because on the dashboard for the entire public health group or the collaborative, it's hidden so that other towns can't specifically look at our town per se to see how
Okay.
but we can look overall at how we're succeeding.
Okay.
So my question about the dashboard to the group was, will we be trained in how to use the dashboard even and access it? And I think it'll be similar probably to the dashboard we had for COVID, where
Okay.
once we learn how to use it, it'll become familiar with us, and you
Okay.
can look at it once a quarter or once a month or however you want to check on it and see what our status is.
Okay.
And when I read that one, what I see is language that they pulled from the grant requirements
Okay.
about reporting back to the funder
Yeah.
how the money's being spent.
That too, yeah.
So,
Okay.
and I think
And that's the lead agency's responsibility, which is Greenfield.
Okay.
I think a lot
Right,
of
but they'd have to get the data from us presumably, so we would have to, we would be providing information about, how many patients the public health nurse saw or data of that. On that order, I would think.
No, I think the public health nurse will have that data, but I think an example is what we had to report this week, Kat, which was, what have we budgeted for our health agent and our health agent's expenses, for example? And we had to look around and see what that actually was. And, we had to put that together. So that kind of information.
Okay. Right, I was just thinking of what kind of outcomes we might be reporting on. That's not an outcome.
Well, another example of an outcome, and I can't remember all of them, but on the dashboard, they had certain requirements for us. One was joining the Tobacco Commission, because we were one town of the 6 that wasn't on the commission. So we've already done that. We've already met that objective. We voted last time we had a meeting to join the Tobacco Commission, and Greenfield is, helping fill out that application on our behalf. So there may be other things like that. I can't think of anything off the top of my head, but they specify for us what our objectives are for the upcoming fiscal year. Like, we're getting this additional money, but they'll expect us to, do certain things, which will be specified ahead of time. They're not going to be surprises to us that we don't know what they're asking us to do.
One of the things that came up at the district meeting last month, and Phoebe was there talking about the capacity assessment with the other 2 towns. And everybody was talking about all Board of Health members having to have ICS training. Now,
yes.
some of us had it about 150 years ago. And if there are any certificates for it, I have no idea where they might be, but I'm going to ask Lenny if maybe the fire department has them. But I don't know.
Oh.
I don't know if we all have had it.
I had to submit documentation of my ICS training for MRC. And I was able to dig it up, but I can't remember how. I'll figure out how
I'll
I
bet
did.
I did too, because did we document it, or did they just take our
We
word?
just reported it. They took our word for it.
Oh, did they? But I was
Yeah.
pretty sure I went and looked it up because I wanted to make sure I was correct about which levels I had had.
So
Right.
let me
But,
address
huh.
that a little bit, because the committee for the collaborative is talking about that right now, and these courses are offered online.
Hmm.
And also Carolyn has offered, she gives the classes to her volunteers once a year. So she's offered, if anybody wants in-person classes for, say, ICF 100, and I should know the
Right,
letters, but I
700
don't.
is the one you take first,
700.
and then 100.
Right, okay, thank you. So what we were talking about is, I think the state is encouraging all board members to have that level of background or training. But what we might do is, for example, one suggestion I made is maybe we should start with people like, I'm volunteering you, Garrett and myself. I'm sure Garrett probably has them already because of what he does for work. But since we're on the emergency management team, maybe it makes sense that at least those two people on the board have all of the courses. Now we can encourage everybody to have them. That would be great. And I'm sure we'd get more points, more credit, maybe even more money. I don't know. But those are, yes, that will probably be another thing that will be required of us to participate in this grant. So I can get back to you and see how we want to do it, whether we want to suggest all board members try and get those basic courses in, or maybe we start with, like I said, a few members who might be also working with the emergency management team, and it makes sense for them to have it.
Well,
Any
I had
feedback
them-
on that?
Yeah, I had them in, 700 and 100 back in the dark ages, but I mean,
too.
that was a long time ago. I would be glad to do it again.
Okay,
Yeah, and you can request your if you don't have the certificates, you can request them from FEMA.
Mhm.
And but even if you retake them, your new certificate will be dated. If I remember, it's a weird thing that FEMA does. Your new certificate will be your previous date
Uh-huh.
of when you completed it,
Interesting.
even if it's a new version of it.
Uh-huh.
I'll find the how you can request your transcript and send it to the group.
That'd be good.
and so what is our preference? Does everybody want to take the basic courses? And I can forward some information on that. I have it, I just haven't done it.
I also have the links for doing it online,
do?
but
Yeah.
if Carolyn is doing an in-person course, that would be good. Is it a long-term thing, or is it a one weekend, or how does it work?
It's a couple of hours, I think she condenses it into, and she does it in the fall. And I think she said she was willing to, I don't have my notes in front of me, but I believe she said she was willing to do it again this September. She offered to do it for any boards of health members who wanted to come to Deerfield, and she would give it.
I'd like to do that if it's available.
Okay.
By the way, I have located an email sent by you, Kat, on January 14th, 2021. Dear all, Walter Tibbetts has provided me with copies of ICS 100 and 700 documentation for me, Arlene, and Noreen.
Oh, cool.
And there are 4 attachments and certificates attached to. So I will send this back to you and to Kat and Noreen. Okay.
Great.
Yeah, that'd be great.
But we
And-
should probably all update anyway, since it was the dark ages when I took it as well.
Sure. Oh, excuse me. The 4 that are attached do not include the ones for you, Kat. It must have been that he sent them regarding the 3 of us, but you forwarded along only mine and Noreen's, and you
Well,
kept.
send it to me anyway, and then I'll be able to localize it and see if I can find my own.
Sure.
But
Okay.
clearly Walter had them, which means that now Lenny has them. And so if we need to
Sure.
lay hands on them, we can get them from Lenny.
Okay.
And
And,
back to
and this will
that
have dates on it and stuff, which will be helpful.
yeah, and that is the other sort of reporting that we will probably have to do to this, give to this collaborative.
Right.
Let me just ask you, Wim, are you interested or willing to participate in this? I'm just taking feedback back to the collaborative to see if we want to encourage all board members to attend these.
I haven't said anything because I have no idea what it is.
Oh, ICS is the incident command system, and it's sort of how you have a hierarchy of functions and roles during an emergency. So usually the emergency management director is like the top banana, and then all the other different players have different roles in it. And basically you kind of go through scenarios about where you would fit into the hierarchy and who you can talk to and who you can't, and how you have to call people by their role instead of by their name. And it was most of what we learned, I think, was fairly rudimentary. Of course, this was really a long time ago, so we may have learned something more than that.
Yeah, so if you think that would be of use, I don't object to doing it. It sounds like the kind of thing that we do in the jail all the time. Sounds like paramilitary stuff.
Well, yeah, kind of.
Well, here's the other
Yeah.
thing. If we go to Deerfield and do it with Carolyn, we can go to Treehouse afterward and have some pizza and maybe something to go along with it.
I like the way you think, Noreen.
Thank you.
At one point, the goal was to have 80%, I don't think just boards of health, but like 80% of town government have ICS training. And so if you divided it up among everyone, that would have been 4. We should have had at least 4. But if we can all have it, I think that'd be good.
Yeah, that would be good.
I thought at one point they had sort of phased out ICS, but it sounds like it's back.
This thing that I volunteered for during the pandemic, this medical corps.
Medical Reserve Corps?
Yeah.
Yeah.
It sounds like the kind of thing everybody was addressing everyone else by their title there. So
Yeah.
they're probably pros at this, right?
Yeah.
Yeah.
So can we get back to the IMA?
Yeah.
Is your question answered, Arlene?
I think it is. Yes. Thank you.
Okay. Then what I was thinking, and I'm certainly open for comment, is that maybe we should contemplate making a motion to have Kat sign off from the IMA once the select board and Donna have had the opportunity to take a look at it and make their recommendations so we can keep this moving. The goal is to have all of the town's IMAs signed by the end of the month so that our public health nurse can actually start delivering services around June 1st.
Mhm.
So does that mean it has to go on the agenda for the select board?
I don't know, Kat, do you know the answer to that?
Yes, it'll have to go on the select board agenda before they will sign it. And I believe I asked Becky to get it on the agenda for May 9th.
Okay.
I should
So
remind her.
should I make a motion to the effect that I just
Yeah.
spoke to?
Yeah.
I would move that we approve Kat signing the IMA on behalf of the Board of Health, subject to the select board and Donna McNichols approving the same, approving the IMA.
Second.
Discussion? We ready to vote? Okay, Arlene,
Yes.
Wim,
Yes.
Noreen,
Yes,
Garrett,
Yes.
Kat, yes. Okay. Do you have more to tell us, Noreen, about what's going on with the?
I
Philanthropy
probably
or-
do, like I had completely forgotten about the ICS, so I'll say no and I'll catch you up at the next meeting if there is more that I've forgotten. I did also mention that we're getting more money for next year, so that's a good thing. I think they're already happy with the way we've pulled ourselves together and how we are setting up our goals and objectives and working with the state. I think it's good news.
Great.
And it's a good
Excellent.
team. I enjoy working with this group very much.
So you're our representative.
Yes,
on
we
that.
actually voted that. I think it was a couple of months ago, Kat. So it was official. It had to be made official. And Garrett is our alternate.
Very
And
good.
so if I'm not there and able to vote, like when I was away, Garrett sat in on the meetings and voted. So I'm trying to, he probably is trying for me not to do this, but I'm trying to make sure he gets included in all of the emails that come from that group so he can stay up to speed.
That's fine.
That's fine. Okay, good.
Okay, well, I have an update for you. If you're done updating us on things, Noreen,
Yeah,
let's move-
I am done.
so let's move on to the complaint. The only
Okay.
action I have taken with respect to this complaint about the about 032 is to speak to someone from DEP, one of the people who was named in one of the many letters that accompanied the complaint. By the way, that Elizabeth Steinhardt died and she's been replaced by someone else whose name I remember just now. Anyway, I talked to one of the named people, and he said that he and also Elizabeth Steinhardt's replacement, who also is named in one of these documents, have both been in contact with the complainant, so they know all about it. And what this person said to me was, you should check with town council because for jurisdictional reasons, because he said, as you know, as DEP, we don't really expect to have, a sort of lower level of entity intervening in an ongoing investigation of the site. So I ran that past Donna, and she said that seemed, a perfectly reasonable point of view, and she reiterated her belief that we should simply ask for all the testing reports to be made available to us. So I know that there are a lot of them already out there, and so what I thought I would do was just ask Becky to point us to them, to send us, so that we would have an actual document. It can be email, but an actual traceable document that gives us maybe a link to wherever these test results are, so that we can say that we did this. And then we'll have them.
Right, and we could pull that up if necessary in the future to demonstrate that we'd received all of those reports, correct?
Right.
Yeah.
And that we responded appropriately.
Yeah.
Garrett, you look like you were about to speak.
I imagine DEP is getting all of the same test results as well. So
Yeah.
on their radar.
Right. And in fact, this person mentioned to me that all these reports are available online from them on their site. I'm not exactly sure how that would happen. But basically what I want to have is, I want to have evidence that the town has made them available to us, either directly or by sending us the appropriate link. So was there anything else on the agenda? I don't have it in front of me that that we had to do. We didn't have any real business. I'm not prepared to tell you anything about 56 Wendell Road, so I'd like to pass over that.
Is there any word back from the select board about the opiate settlement, the funds? Did they vote on that too? Because it was gonna go in front of them, right?
Yeah,
Correct.
they voted to approve it, and Becky and Rita completed the requests or the forms that needed to be submitted for each settlement.
Great, so we're in business.
Yep. And so then the next piece of it will be the IMA, so that we can then encourage that those funds get placed with the other communities.
Yeah.
And that has to happen after the IMA is signed, so that we actually have an IMA to share with.
Yeah.
I mean, to have a collaborative to share with. Okay. Oh, speaking about May 9th, May 11th is the end of the public health emergency. And so one of the immediate effects we're going to see is no more free tests. And I'm thinking maybe we should put out a public message about this. We haven't been doing that recently, but maybe giving an idea what the changes are going to be in benefits and other provisions that went with the state of emergency. Any thoughts about that?
I think it's a good idea. We could also wrap into that who's eligible for another booster.
Oh, good point.
Bivalent. All.
Right. Well, didn't I read that the monovalent, all the monovalent shots are now no longer authorized?
Correct.
So it'll have to be bivalent no matter what. Yeah. Yeah, for the newsletter, I don't like to put too much in it because it's never timely by the time it comes out. But maybe we can send out either a long message or a series of messages. Just talking with John Briggs now, we should probably do, the bug message that we do every. Maybe 3 out in rapid succession. So I'll be asking for your editorial assistance and input on that. And this is the third. So probably we should get started on the May 11th one pretty soon. So I'll try to get started on it tomorrow.
Can I go back to Wim's question on the opioid settlement, and just so I know to take the information back to the collaborative, could you just summarize again for me what has happened? I understand, I think, Garrett, that the select board has filled out the paperwork to receive the opioid funds in the town once they're distributed from the state to the towns. Is that correct?
Yes, so the select board voted to an approval of pursuing the funds.
Okay.
And then Becky and Rita jointly submitted the forms to the state.
There are those participation forms, and
Yeah, okay.
they have to be done online, and
Okay.
they did those.
Okay, so that then frees us if the, again, select board decides and the collaborative decides to pool our funds with the collaborative down the road. Is that correct?
Yes. Now,
Okay.
now the other thing that's going to have to happen is that there's going to have to, the town's going to have to set up some sort of, and it's complicated, some sort of accounting mechanism for receiving the funds, because they won't come, they're going to come in sort of bits and pieces, and there's
Right.
going to be a rhyme or reason to how the money comes in.
Right.
So I think that and I don't know the inner workings of all of this, so I assume that they're going to have to set up something like a revolving fund or so that's something that we might want to just bring up to Becky, that the accounting piece of this will have to be reviewed. And I know that for COG did a presentation on some of the complexities of this, and that there was maybe going to be state legislation to change it.
Right.
But I don't know where things stand with that, but it's something that'll have to be addressed at the administration level.
Okay, and are you the one who's interfacing with Becky to find out if that account is getting set up? And
I can, yeah.
I think Kat had asked you previously to work on it, so I was just confirming if that's still the case. That'd be great
Yeah,
from my point of view.
I'll reach out to her and see what her next steps are for that.
Okay, so and if you just keep me in the loop, or if you want to come to a collaborative meeting, I'll just let them know that we're working on that our town is moving forward. And how. Okay, great. Thanks.
And I had one item, and that is that DPH is going to conduct a HON drill in the next
Oh, right, next
That's right.
week. Yeah.
and that HON drill is going to request that local boards of health log on to the MDPH WebEOC
Mhm.
and complete some sort of an action. So I alerted Kat to that, so she'd be prepared for logging into WebEOC. But then I also contacted the HON coordinator just to see what our current list is in the HON. And what I got back is a little bit different than what I remember it being. But so Arlene, you're in there.
Yeah, do I know how to log in is the other question. Okay,
So you're in there with your Mount Holyoke address. I don't know if that's still.
thank you. I'm gonna look at my password manager and see what I've got.
Yep. So you're in there, Kat, you're in there with your Gmail. Shutesbury Police Department is in there. Wim, you're in there with your Gmail account. Walter Tibbetts is listed with a Yahoo account, but also the fire department account. And in the past, so currently it's not showing that I'm in there or Noreen's in there. So I can contact the HON coordinator to have her update that. But in the past, I think Becky was also in there. And she's not showing up in there.
So how does this work? They'll
Hmm.
send us an email?
It'll be, so it's an electronic notification system. So it'll generate a notification based on what you have. It'll probably come to your email, and you've got 2 phone numbers listed in there. And then it would basically, ask that you take a particular action, and this action is on a platform that's a shared login. So it's just a single Shutesbury Public Health and a single password. So probably for the drill, I assume, Kat, that you'll respond for us on that, or?
Well, that would be good. However, I got the notification from somebody.
Me,
No, not from you, from somebody at in the state. Because believe it or not, Noreen, the Board of Health gets all this stuff.
Oh, okay,
I know you always
good.
send me things, but I get them.
Okay,
Often I get them twice, on both emails, but the Board of Health gets all this stuff. Now, what I am looking for, and anyway, what I'm trying to explain is that somebody sent me this notification. Oh, it was here, Dan Nietzsche. And he says, During the week of 8 May, MDPH OPEM will be conducting a statewide web EOC drill via a HAN message. Communities will be instructed to update the EDS board information. So that's where we can catch up with that stuff. If your community needs HAN and or web EOC assistance / passcode resets, please contact Gail Bienvenue. Gail reported that she would gladly meet with local public health representatives. So I sent an email to Gail Bienvenue and said, we need a passcode reset, because I have no idea what our passcode is, because we haven't had a drill for like ever. And that was days ago, and I haven't had any response. So that's kind of discouraging. So I have no idea what our passcode is.
Well, Gail has been communicating to me about other matters, and I have a meeting with her on Friday, so I will be certain
Awesome.
to
Well, would
mention
you,
that to her, Kat.
Please do.
Okay, so we need a passcode reset. Okay.
Yeah,
For Shutesbury.
or else we just needed to remind us what the passcode is, because if anybody knows it, they could send me a text and we'll share it, offline. But
Somewhere I have it all on a piece of paper, but I don't know where it is.
yeah, I think I have it on my old computer, but my old computer doesn't go on.
We do, Kat. We've checked each other on it before, and
Yeah.
I don't know where it is.
And I use a password manager, and I'm looking it up, and I don't see that I have my Mount Holyoke address as a username anyway. And when I try to launch from the password manager, I reach an invalid site. So I have a recorded username and password, but I don't have the link to go to Han, evidently.
Right. Yeah, I don't have that anymore
So
either.
if you Google MDPH Han, it'll
Yep.
bring you to a web page that I think says something like
Oh yeah, system logins for partners.
system logins for partners.
Yeah.
Then from there you should be able to click on the Han.
Okay. Yep. And then let's see if my username and password work. You all don't have to
We're
sit here in suspense.
I
And
just
drum roll,
just-
please. I'm in.
all right. Wow.
Wow.
Well,
Well,
that
let's
worked.
designate Arlene then.
Yeah, I guess you're the one who's gonna respond.
Oh, and I see all these tests. There was a test on February 14th. And okay, a whole bunch of things that went unacknowledged. All right.
Hmm.
Wow. Maybe they're sending everything to my Mount Holyoke address, and I rarely check that anymore. So I should change my profile. Okay.
Well, that
Well-
apparently is what's supposed to happen during the drill. It said something about update the board information. So maybe we should just wait and do all that updating
Ah.
when it comes. But yeah, if you can get in, Arlene, you get the notification.
But that's a separate system. So that's the Han.
Oh.
That's
Okay.
the Han. That's not the web EOC
Oh.
drills.
Oh,
Yeah.
Okay,
Right.
so what about the web EOC part of it? Are we going to have? I'm sorry, I'm being really stupid here. Is this two things or one thing
So
we're
it's
dealing with?
it's sort of two things. So the Han is the notification system
Uh-huh.
that is going to queue or let us know that they want us to log on to WebEOC.
I see.
WebEOC is a information platform where the
Right.
ES boards are, and they're going to want you to log into that,
Right.
want us to log into that and update that.
Right. Got it.
Yeah. I don't have a
Okay.
login for that.
Okay, so yeah, I don't know if I have it anymore, but I probably don't. I mean, we probably just need to get a new one.
I'll send Gail an email too. She just emailed me today, so maybe she'll
Oh,
get back
great,
to me
yeah.
and get back.
She-
Yep.
Yeah, mine must have just fallen off her front page or something, because she just didn't answer at all.
Okay,
I think on my
But
old
when
computer.
you go to, I just found the web EOC login, and it says to request a user account, contact, and then it gives you an email and a phone number. But when I just click on the thing that says click here to log in, there's a way to register. There's a link for registering if it's your first time using it.
Right, but it's
So-
not our first time using
Not my
it.
first time. I get
No.
it. Yeah. But,
So each Board of Health,
oh, and there's a reset my password link in here. Oh. All right, I'll work on this on my own time and see how far I get.
Okay. Okay, and meanwhile, Noreen can confer with Gail and see if we get any information there. And I'll also look on my computer and see if that got carried over, because I replaced my computer at some point.
and
See if I can find it.
Garrett, I haven't even read this email, but apparently I got an email from Gail today, and I think it was asking all of us to update all of our HAN and web EOC information. Is that what you were thinking of, or it sounded like you had heard that too?
yeah, so in my work in the eastern part of the state.
Right, yeah,
yeah, I've just been helping them go through that same process.
yeah.
So I just also checked in on where we stood with our HAN accounts.
Thank you and bless you. So
But,
yes, I might be contacting you because I haven't even read this email from her. It came in this afternoon. I haven't had a chance.
I think ultimately we'll want to figure out, we'll want to try to communicate with probably both the police chief and the new fire chief, because they're in the HAN, but they may not be as familiar with what it is.
Yeah.
Right.
Yeah, and at some point, Garrett, we probably need to encourage the fire chief, if he's going to. Who is the emergency management team director now? Do you know, even know?
Lenny.
It is Lenny. Okay, so we should encourage him to have a emergency management team meeting so we can talk about all this stuff.
Good idea.
Not that I want to go to another meeting. Trust me, I do not.
Oh, we know you live for these meetings, Noreen.
Yeah, yep. Treehouse pizza.
Right, right.
Right.
Okay, yeah, if you'll get in touch with Carolyn also, or when you see her next, tell her we would be interested in
Yeah, yes, I will do
taking-
all of that.
training live with her.
And I do know 3 people on that meeting Monday,
Great.
the mosquito group, so. Okay,
Okay.
I'm
Is there-
kind of done. I move we end.
Anybody else have anything to add? Okay, well, anybody who finds out anything about the drill or the web EOC or anything, just share it around, okay?
Sounds good.
Okay, so let's